Selma. I'm in BSN 266, Section 8, and this is my IV administration fluids video. So the first thing I'm going to do, I'm going to go ahead and conduct hand hygiene. Okay, place my gloves on. Okay, I'm going to hang my first bag of fluids. Okay, and then open my first set of tubing. Okay, so for part one, I'm going to go ahead and label my IV tubing. First part is the spike, the drip chamber, the clamp, and the Y connector, and the adapter. Okay, so I want to make sure I hang the IV tubing 30 inches above the patient because it's going to go ahead and support the flow rate, and gravity is going to go ahead and take the wheel on administering the fluids. So I'm going to go ahead and spike the bag. Make sure I clamp the tubing. Okay. Want to make sure I fill a third to halfway. Okay. And then I'm going to begin priming the tubing, and by priming, I want to make sure there are no air bubbles because that can cause an embolism in the patient. Okay. Go ahead and clamp. I'm going to go ahead and calculate my flow rate. So, well, not my flow rate, my drips per minute. So I was told to go ahead and my flow rate was 150 milligrams per hour. The drop factor is on the bag, and it is 15 drops per mil. So what I'm going to do, I'm going to go ahead and divide 15, the drop factor divided by 60, and multiply that by 150. So with the help of my calculator, 15 divided by 60 times 150 is going to be 37.5. However, I'm going to round up, and that's going to give me 38 drops per mil. Before I continue, I also want to make sure I do my 6 rights of medication, which is going to be the right drug, right patient, right dose, right medication, right time, right route, and right documentation. I also want to make sure I ask the patient for any allergies that I should be aware of, so I don't get any adverse reactions. So now that I have my drip factor, I want to go ahead and set it to 38 drops per minute. So I'm going to go ahead and grab my watch. Let this go. Hold it. Yes. And I want to watch for 1 whole minute. Slow it a little bit. Okay. Perfect. So I'm going to go ahead and confirm that that is 38 drops per minute. I'm going to go ahead and leave that. Okay. Next part is I'm going to go ahead and continue on to part 3. For part 3, I'm going to go ahead and conduct an IV piggyback infusion. So for my IV piggyback, I'm going to have to use 250 milligrams of my amoxicillin, and that would be mixed with my 100 milliliters of sodium chloride, normal saline. So in real life, I would have the powdered solution, and I would reconstitute it into the normal saline bag. But I'll go ahead and just verbalize that. So I'm going to go ahead and hang my bag for now. In the hole. It's okay. So I'm going to go ahead and just grab the tube. And just go ahead and just lower my primary bag already. Okay. So I'm going to go ahead now and give my flow rate. So since 250 milliliters are going to be infused in 100 milliliters in the normal saline in over 15 minutes, what I'm going to do is I'm going to multiply 100 milliliters of the normal saline times 60 over 15 minutes. And that is because we're using a pump and it only does the infusion in hours. So I want to convert that into hours. So when I do the math, 100 times 60 divided by 15 is going to be 400 milliliters per hour. For my drip rate, it's going to be the same phase in part 1. So I take my 15 drops per milliliter, which is the same for this normal saline bag, the drop factor. I'm going to do 15 divided by 60 times 400, and that's going to be 100 drops per minute, and that's going to be my drip rate for my amoxicillin. All right. I'm going to grab my secondary set of tubing. I'm going to go ahead and remove this and the tube. Strike the bag. There we go. Fill the drip chamber halfway, and I want to unclamp. And prevent any air bubbles from accumulating. Okay, I'm going to clamp that up. Right, it is primed. There are no air bubbles. Okay, I'm going to go ahead. Now that it's leveled up, I want my primary tubing lower than my secondary bag because the secondary bag is going to use gravity for being higher to tell that pump that the secondary bag is going to pump first their infusion. Okay, so I'm going to grab my alcohol pad, but before I do that, I'm going to go ahead and place the medication added sticker on the bag. I would simulate that. And then on the medication added sticker, I would place my initials, the date, the start time, flow rate, base solution, room number, patient, and drug type. Just so on next shifts, they will know, the next nurse will know what is going on with this infusion and when the tubing has to be replaced. Okay, So now I'm going to go ahead and grab my alcohol prep pad. I'm going to clean the Y port. Let dry. While that's drying, I'm going to go ahead and connect my secondary tubing to the Y port. Go ahead and make sure that my normal saline is clamped and my sodium chloride with the amoxicillin is going at the 100 drops per mil rate. Okay. So now that that's connected, and when I go ahead and start the infusion on the patient, I'm going to go ahead and explain my clinical judgment area. So I would delegate my nurse aide to go ahead and let me know when the infusion stops. And then I would also ask the nurse aide to go ahead and let me notify me if the patient is experiencing any burning of the medication, because that can be caused by phlebitis or infiltration, and I want to go ahead and act accordingly by either stopping the infusion and also notifying the provider. I also want to make sure I assess the IV site every 2 hours to make sure there's no infiltration of phlebitis. Other than that, I'm going to go ahead and clean my gloves, take off my gloves, wash my hands, and that is the end of my skill.